It's 2 in the morning on a Kansas prairie in 1888. A rancher pounds on Dr. Samuel Crumbine's door so hard the frame shakes. His wife is in labor. Something's wrong. The baby won't come. Dr. Crumbine pulls on his coat, grabs his medical bag, which weighs barely 8 pounds and contains almost everything he owns that could save a life, and climbs onto the rancher's wagon. They ride 7 miles through darkness to a sod house where a woman is dying. Inside, by the light of 2 kerosene lamps, Dr. Crumbine will deliver a breech baby. He has limited instruments, no hospital, no trained assistants. What he does have is training from medical school, a handful of silk sutures, whisky for sterilization, and the knowledge that if this fails, both mother and child will die. This is frontier medicine, not the sanitized version you see in movies. This is the real story of doctors who performed amputations by candlelight, delivered breech babies in sod houses, and removed bullets with nothing but their fingers and hope. Between 1850 and 1890, as the American frontier pushed westward, doctors followed. They set up practice in mining camps, cattle towns, and farming settlements where the nearest hospital might be 300 miles away. They worked alone, exhausted, improvising constantly with supplies that wouldn't fill a modern paramedic's kit. And somehow, against impossible odds, they kept people alive. When the covered wagons rolled west in the 1840s and 1850s, very few carried trained physicians. Most wagon trains had to make do with whatever medical knowledge the travelers brought with them, which was usually almost nothing. Pioneer families relied on home remedies, folk medicine, and prayer. They treated fever with willow bark tea, which actually worked because it contained salicin, the active ingredient in aspirin. They used whiskey as an anesthetic and antiseptic. They set broken bones with splints made from wagon boards. When these methods failed, and they often did, people died. Cholera killed thousands on the overland trails, so did dysentery, typhoid, and infected wounds. Childbirth was particularly dangerous. Approximately 1 in 100 to 1 in 200 women died in childbirth on the frontier, dramatically higher than in eastern cities where doctors and midwives were more available. By the 1860s, as permanent settlements formed, doctors began arriving in the West. But they faced challenges unlike anything they'd encountered in medical school, if they'd even attended medical school at all. In the mid-19th century, American medical education was chaotic. Some doctors trained through formal apprenticeships, others attended medical colleges, though the quality varied wildly. A few schools required 2 years of study. Others graduated students after just 4 months of lectures, and some men simply called themselves doctors without any training whatsoever. There was no licensing requirement in most Western territories, no board exams, no standardized curriculum. If you had a medical bag, some basic instruments, and confidence, you could hang out a shingle and start practicing medicine. The good doctors had trained in Philadelphia, Boston, or New York before heading west. They'd studied anatomy, surgery, and pharmacology. They understood the principles of sanitation, even if germ theory wasn't yet fully accepted. Either way, once you were on the frontier, you were often the only doctor within 50 miles. Your patients had no choice but to trust you, and you had no choice but to do your best with whatever you had. When the Union Pacific Railroad reached Cheyenne, Wyoming Territory in November of 1867, the town exploded overnight from empty prairie to 4,000 people. The railroad pitched a large tent that served as a hospital for workers injured during construction. Doctors treated employees crushed between freight cars, burned by steam engines, or mangled by construction equipment. These frontier doctors had minimal supplies, no surgical theater, often no proper anesthesia. They performed amputations using saws boiled on stoves. They stitched wounds by lamplight. They extracted bullets with forceps designed for childbirth. The medical bag a frontier doctor carried was remarkably sparse. In the 1870s, a typical bag contained a scalpel, a few surgical needles, silk sutures for stitching wounds, a bone saw for amputations, forceps for extracting bullets and assisting in childbirth, a stethoscope, a thermometer, a few glass bottles of laudanum, quinine for malaria, calomel for digestive ailments, and sometimes chloroform or ether for anesthesia. If the doctor could afford it, and if the supply hadn't evaporated or spoiled, that was it. That was everything a frontier doctor had to treat gunshot wounds, broken bones, infections, fevers, childbirth complications, snake bites, and every other medical crisis imaginable. Anesthesia was a luxury most frontier doctors couldn't rely on. Ether had been introduced in the 1840s, and chloroform became available in the 1850s, but both were expensive and difficult to transport. They evaporated easily. They had to be stored in sealed glass bottles, which broke during wagon travel. Many frontier doctors simply ran out. When that happened, they performed surgery without it. Patients were given whiskey, as much as they could drink without passing out. Sometimes they were given laudanum, which dulled pain but didn't eliminate consciousness. Leather straps or ropes tied them to the table. Strong men held down their arms and legs. Then the doctor worked as quickly as possible. A skilled surgeon could amputate a leg in under 5 minutes. Speed was critical, not just to minimize the patient's suffering, but to reduce blood loss. Every second counted. Dr. Samuel Crumbine arrived in Dodge City, Kansas in 1888, fresh from medical school. He described amputating a cowboy's arm after a horse riding accident shattered the bone beyond repair. The cowboy was conscious the entire time. Crumbine wrote that the man never cried out, though tears ran down his face. When it was finished, he said, "Thank you, Doc," and asked for a cigarette. That level of stoicism wasn't uncommon. Frontier patients understood that medicine was painful. They endured because they had no choice. But not every patient survived. Infection killed more people on the frontier than accidents or violence, and doctors had no effective way to fight it. Germ theory, the understanding that bacteria cause disease, wasn't widely accepted in America until the 1880s. Before that, doctors believed diseases were caused by bad air, rotting organic matter, or imbalances in the body's humors. This led to disastrous medical practices. Doctors didn't sterilize their instruments. They didn't wash their hands between patients. They reused bandages. They probed wounds with fingers that had just handled another patient's infected injury. Post-surgical infections were so common that they were considered almost inevitable. One doctor in Montana in the 1870s noted in his diary, "Amputated miner's leg above the knee. Operation successful. Patient died 4 days later of blood poisoning." That phrase, "Operation successful, patient died," appears over and over in frontier medical records. Childbirths on the frontier were particularly dangerous. Without access to hospitals or experienced midwives, women often gave birth at home with only their husbands or neighbors to assist. Dr. Bethenia Owens-Adair was one of the first women in Oregon to earn a medical degree. Born in 1840, she traveled the Oregon Trail as a child. Married at 14 to an abusive man, divorced at 19 with a young son, she worked as a milliner while educating herself. In 1873, she left Oregon to study medicine at the Eclectic Medical College in Philadelphia. She returned in 1874 with her medical degree. The local medical community was skeptical, both because she was a woman and because her school was considered disreputable. So in 1878, at age 38, she enrolled at the University of Michigan Medical School to earn legitimate credentials. She graduated in 1880, did postgraduate work in Chicago and Europe, then returned to Oregon to practice. In 1884, she married Colonel John Adair and moved to a farm near Astoria. There she practiced as a country doctor, traveling great distances alone in her carriage to reach patients. She later recalled, "At no time did I ever refuse a call, day or night, rain or shine." In one difficult case, she was called to deliver a breech baby, positioned feet first instead of head first. Working by lamplight on a kitchen table with no surgical tools and no anesthesia, she manually turned the baby. It took nearly an hour. The mother was in terrible pain. But it worked. The baby was born alive. The mother survived. Not all births ended so well. Puerperal fever, an infection of the uterus after childbirth, killed thousands of women on the frontier. It wasn't until the 1880s, when doctors began accepting germ theory and adopting antiseptic practices, that maternal mortality rates started to decline. Gunshot wounds were a constant challenge for frontier doctors, not because they were common. Despite Hollywood's obsession with shootouts, most frontier violence came from accidents, but because they were so difficult to treat. A bullet entering the body doesn't just create a hole. It carries fabric, dirt, and bacteria deep into the tissue. It shatters bones. It ricochets off ribs and lodges in unpredictable places. Doctors used metal probes to locate bullets. They'd insert the probe into the wound and feel around, sometimes for hours, until they hit metal. Then they'd use forceps to extract the bullet, hoping they didn't tear an artery in the process. Dr. George Goodfellow practiced in Tombstone, Arizona Territory during the 1880s. He arrived in 1880, a 25-year-old physician who would become America's foremost expert on treating gunshot wounds. Tombstone was notorious for violence. The silver mining boom attracted outlaws, cowboys, gamblers, and lawmen. Disputes were often settled with guns, and when men were shot, they came to Dr. Goodfellow. He treated outlaws and lawmen alike. He never asked questions. His interest was solely in saving lives. On October 26, 1881, the gunfight at the OK Corral left 3 men dead and 2 wounded. Virgil Earp was shot through the calf. Morgan Earp was wounded across both shoulder blades. Goodfellow treated both men's injuries. 2 months later, Virgil Earp was ambushed with a shotgun blast that shattered his arm. Goodfellow removed 3 inches of bone from the humerus and saved the arm. When Virgil's wife Allie rushed into the room, the wounded man said, "Never mind, I've still got one arm left to hug you with." In March 1882, Morgan Earp was assassinated while playing billiards. 1 bullet passed through his body and lodged in the thigh of a bystander. Goodfellow determined that Morgan's wound was fatal. The spine was damaged and major arteries severed. Morgan died within the hour. Goodfellow pioneered sterile techniques in treating gunshot wounds. He washed the patient's wound with lye soap or whiskey. He boiled his instruments before surgery. These practices, radical at the time, dramatically reduced infection rates. On July 13, 1881, Goodfellow performed the first documented laparotomy to treat an abdominal gunshot wound. A miner had been shot 9 days earlier. The bullet had perforated his small intestine, large intestine, and bowel. Standard medical practice said not to operate. Opening the abdominal cavity would cause fatal infection. Goodfellow operated anyway. He sutured 6 holes in the man's organs. The patient survived. 2 days earlier, President James Garfield had been shot in Washington, D.C. 16 doctors attended him. Most probed the wound with their unsterilized fingers or dirty instruments. Historians agree that massive infection was a significant factor in Garfield's death 2 months later. The miner in Tombstone, treated by a frontier doctor with boiled instruments and antiseptic techniques, lived. A laparotomy is still the standard procedure for treating abdominal gunshot wounds today. Goodfellow became America's leading authority on gunshot wounds and is widely recognized as the first civilian trauma surgeon. He once traveled to Bisbee, 30 miles from Tombstone, to treat an abdominal gunshot wound. He operated on the patient stretched out on a billiard table, removed a .45 caliber bullet, washed out the cavity with hot water, folded the intestines back into position, and stitched the wound closed with silk thread. He wrote, "I was entirely alone, having no skilled assistant of any sort, therefore was compelled to depend for aid upon willing friends who were present, these consisting mostly of hard-handed miners just from their work." The patient survived. The tools of frontier medicine were crude, but in skilled hands, They could accomplish remarkable things. The bone saw was used for amputations, which were among the most common surgical procedures on the frontier. A crushed limb from a wagon accident, a shattered leg from a horse fall. If the bone was too damaged to heal, amputation was the only option. The procedure was straightforward but agonizing. The doctor would tie a tourniquet above the amputation site, cut through the skin and muscle with a scalpel, then saw through the bone, quickly, because speed reduced suffering. Once the limb was removed, the doctor would tie off blood vessels with silk sutures, fold the skin over the stump, and stitch it closed. If the patient survived the shock and blood loss, they still faced the risk of infection. Survival rates for amputations on the frontier were around 60 to 70%, remarkably high given the conditions. Frontier doctors, working alone with minimal supplies, came close to matching Civil War field hospital rates. And then there were the improvised tools, the instruments doctors created when they didn't have what they needed. One doctor in Montana, faced with a patient who had a fishhook embedded deep in his hand, used a pair of pliers and a file to create a makeshift hook extractor. It worked. Another doctor in Texas, needing to drain fluid from a patient's infected lung, used a hollow reed and a rubber tube from a bicycle pump to create a chest drain. The patient lived. Frontier doctors were mechanics, engineers, and surgeons all at once. They had to be. The patients themselves played a critical role in their own survival. Frontier people were tougher than most of us can imagine. One account from Wyoming in 1883 describes a rancher who set his own broken leg using wooden boards and leather straps, then rode 15 miles to the nearest doctor to have it checked. The doctor found the brake properly aligned and told the man to go home and rest. The rancher rode back that same day. Another story from Kansas tells of a woman who delivered her own baby when the doctor couldn't reach her during a snowstorm. She cut the umbilical cord with scissors she'd boiled on the stove, tied it off with sewing thread, and cleaned the baby with warm water. Both mother and child survived. These weren't exceptional cases. This was normal. Frontier people understood that survival depended on self-reliance, grit, and a willingness to endure. By the 1890s, frontier medicine was beginning to change. Railroads made it easier to transport medical supplies. Telegraph lines allowed doctors to consult with specialists in distant cities. Hospitals began appearing in larger frontier towns. Germ theory was finally accepted, and antiseptic practices became standard. Doctors began sterilizing instruments, washing their hands, and using carbolic acid to disinfect wounds. Infection rates dropped dramatically. Anesthesia became more reliable. Surgery became less brutal. Medical schools improved. Licensing requirements were introduced. The con men and quacks were gradually pushed out of the profession. But the old frontier doctors, the ones who'd performed amputations by candlelight, delivered babies on kitchen tables, and removed bullets with their bare hands. They were a dying breed. Dr. Samuel Crumbine continued practicing until 1923. In 1899, he was appointed to the Kansas State Board of Health. He pioneered public health campaigns that changed America. His Swat the Fly campaign popularized the fly swatter and reduced typhoid transmission. His Don't Spit on the Sidewalk campaign fought tuberculosis. He banned the common drinking cup and promoted disposable paper cups. Dr. Bethenia Owens-Adair continued practicing until 1905, when she retired at age 65. She wrote her autobiography and continued her reform efforts, advocating for women's suffrage and temperance. She died in 1926 at her home in Oregon. Dr. George Goodfellow left Tombstone in 1891 and practiced in Tucson. In 1898, he joined General William Shafter's staff as a surgeon during the Spanish-American War. He was awarded a Distinguished Service Order for meritorious service. Goodfellow died in 1910. The University of Arizona School of Medicine established the George Goodfellow Society in his honor. These doctors, and thousands like them, had done the impossible. They'd saved lives with almost nothing. They'd faced nature on its own terms and refused to give up. One frontier doctor summed it up. I had no proper tools, no training in the procedure, no assistance. But I also had no choice. That patient would have died if I'd done nothing. So I did what I could with what I had. And somehow, it was enough. That captures the essence of frontier medicine. Doing what you could with what you had. Improvising, hoping, trying. And somehow, against impossible odds, keeping people alive. The frontier doctor is gone now. Modern medicine has replaced the bone saw and the whiskey bottle with antibiotics and anesthesia. Surgery happens in sterile operating rooms, not on kitchen tables. But the spirit of those doctors, the willingness to try, the refusal to give up, the determination to save lives no matter the obstacles, that spirit lives on in every rural doctor, every emergency room physician, every medic working in impossible conditions. Because the fundamental challenge is the same. A person is dying, and you're the only one who can help. What do? You grab your bag, you ride through the darkness, you walk into that sod house or tent or saloon back room, and you do what you can with what you have. Just like Dr. Crumbine did in 1888, just like Dr. Owens-Adair did throughout her career, just like Dr. Goodfellow did on that billiard table in Bisbee, just like thousands of frontier doctors did every single night for 50 years. Surgery on the kitchen table, medicine at the edge of the world, lives saved by candlelight. That was frontier medicine. And for a brief, extraordinary moment in American history, it was all anyone had.